So our next presenter is Dr. Sally Brinkman. She's an adjunct associate professor at the School of Public Health in the Faculty of Health Sciences at the University of Adelaide in Australia. Sally is a social epidemiologist with the majority of her research focusing on society's impact on child development. She's a co-director of a Fraser Mustard Center, which is an innovative new initiative between Telecom Kids Institute and the South Australia Department of Education and Child Development, aimed to improve research translation. Sally is very well known for spearheading the use of Early Development Institute in Australia. She's being the first person to pilot the instrument outside of Canada. Internationally, she works with governments and other organizations such as the World Bank, UNICEF, and USAID, working with various measures of child development and monitoring and evaluation purposes. Today, she's going to talk to us about monitoring and evaluation in ECC activities.
So thank you for having me, and it's an absolute privilege to be here, and I hope what I present will be of some interest to you. I'm specifically actually going to talk about two examples, Australia and Tonga, because they're my favourites. I've worked in many, many different countries in the world, but these are my two favourite examples that I wanted to be able to show you today. So, now, I'm pretty sure most of you know SDG 4, and particularly 4.2, that's why most of us are in the room right now. The two examples that I'm presenting directly try and report against 4.2, but they were both developed prior to 4.2 as such. But we hit this information to be able to provide detailed, specific, local level, holistic child development information for children and communities across the whole of Australia and the whole of Tonga as my two examples. So many of you will know that there's multiple ways of being able to take measurements, and different people will have different views around whether it is better to have international comparable measures that you can compare across countries, or if you want to take a very strong cultural local context and have an instrument that is specific to your country and your culture. I think there can probably be a happy medium in between the two, and in many circumstances I think actually both can be implemented at the same time. So what I will be talking about here is two local country specific, adapted to the local countries so that they are appropriate for the local cultural application, but they can also be used for international comparison because many of the items within the instruments are actually the same. So over the last 10 years, there's been many new measures adapted, and I think I don't have time to go through all of them, but I did want to mention a few issues that I'm sure some of you have faced as well. Many of the instruments to measure child development actually come out of either developmental psychology or pediatrics. They tend to be licensed, they tend to be costly. You tend to have an agreement with a university or a publishing company, and this can be really limiting in terms of a country's ability to adapt the instruments, and it can also be quite costly in terms of lack of ownership. You really want to be able to have your own instrument that you can call your own, use in your own way without having to be beholden to the licensees. So people are starting to develop their own instruments for their own use. Additionally, most of the instruments have come out of very Western cultures, so they don't necessarily apply to many countries and for different communities as well. Particularly from health, they tend to be deficit-based. So what I mean by this is that actually you're really almost diagnosing an individual child as not meeting their developmental milestones. Now, for most of us, particularly in early childhood education, of course we're interested in that, but we're also interested in being able to undertake interventions that support developing child development, right? So we want to actually see children doing well and children enhancing up scales of development rather than just not meeting or getting above the developmental milestone. So we want to see a developmental range. Most instruments don't capture that. The other thing is, particularly from developmental psychology, many of the items don't actually predict later outcomes that we're interested in. So there might be things like, I don't know, like a child has a specific hand preference and when that hand preference emerges, right? From a developmental point of view, that's a milestone. In terms of predicting anything that we might care about later, in terms of later, I don't know, literacy and numeracy aspects or later well-being, it's a completely meaningless indicator. It's not something that we would then intervene upon. So why would we ask it? If you're a developmental pediatrician, fine. But if we're talking in early childhood education, some of these items that come out of these historic instruments actually aren't relevant to us. I just wanted to present this to give you an idea of various instruments that are available. There are lots of them. There are more than what is presented on this slide. But the most important thing is there's a huge amount of overlap between them. So if you take all of these instruments and look at them and actually compare at an item level, you'll find a surprising degree of overlap between them. They can, however, probably be categorized into three main different sort of things. So direct assessment, that's when you actually have a child, you're directly assessing that child to determine what their development actually is. There's screening diagnostics, so these are the ones that you specifically use to identify a child and then go on to a second stage screen, or you're already diagnosing the child as having some sort of disability or delay, right? And then there tends to be these survey teacher responses, which from my mind, from a population point of view and from a monitoring point of view, I think are very efficient and very effective. So my two examples that I'm talking about today fit within that category. When I look to an instrument in terms of what is important as far as an instrument is concerned, this is my list of what I think we would like to see. Many of those instruments in the previous slide, some of them hit all of these categories, some of them don't. Within the early childhood education space, the two things that I think over and above anything else we want to see is strong predictive validity. So the instrument that we capture at early childhood predicts later outcomes that we care about. If it doesn't predict, then why measure it to then intervene upon in the early childhood space? Some will argue with me about this, but I think from a systems, an education systems perspective, this is really important. The other thing is sensitivity to change. If you are using instruments that are just developmental milestone checks or instruments that are just really looking at developmental delay, and you're putting in brand new early childhood interventions to support enhancing development, you are unlikely to see much change on those instruments because they're just capturing the bottom end of development as such. They're not capturing the whole range of development, and they won't capture children that might be in the middle, but are then enhanced up to the upper scale of development, right? So for an instrument to be sensitive to change, to early childhood interventions, you want them to be not just holistic, but to capture both strengths and weaknesses of children, right? So these are my two examples. The Australian Early Development Census, the instrument is actually originally based on the Canadian EDI, the Early Development Index. And we adapted it for Australia, particularly for our Aboriginal communities, but all children living in Australia, so it's a little bit different to the Canadian version, and we continue to improve it. The instrument has some ceiling effect issues, so we're enhancing the instrument in that regard as well as. And then the other is the Tongan, is the Early Human Capability Index, which has been used in about 11 countries to date, but it was first developed in Tonga with the Tongan culture. So these are completely different examples, relatively rich country, relatively poor country, But in both circumstances, we've taken a census approach. So for Australia, it's every single 5-year-old across the entire country, every single one. So about 300,000 children, and we do that once every 3 years. We've been doing it since 2009. We're just about to release the 2018 census data in about 3 weeks. The Early Human Capability Index in Tonga, we did every single child from 3 through to 5 years of age. Now, Tonga is a country of about 100,000 population, 54 islands. We went to every single one of those islands to capture child development using the local early childhood education system and the maternal health nurses. So we have used our existing systems, and it has cost very little actually, because we're using our existing staff to capture, but at a census level. So this is the Australian Early Development Census. If any of you are interested, you can get onto the website. The data is completely publicly available. There's a whole lot of resources. You can download the instrument, the teacher guide. You can get on, you can have a play with the data. You can look at every single neighbourhood across the entire country and look at how the children have done on each of 5 different developmental domains. And you can look at the change over time at that community level, right through to the local, regional, state, and national level. It's actually, you can spend a lot of time on this website. It's worth having a look at. The resources are also particularly useful for communities working with local data. These are the 5 domains. As I said, this instrument originally came from Canada. It's very Western. We adapted it a little bit. I think we can continue to do so. But it captures 5 domains of development. This is our national data. So 2009, 2012, 2015. We will soon have the 2018 data. What is presented here is the developmental vulnerability on each of those 5 domains. So what you want to see is the lines reducing. So over time, we have actually seen improvements in child development in Australia across the country. The ADC has helped to prompt things like national access to universal preschool, funded by 15 hours preschool. That occurred between 2009 and 2012, and that's where we still see our greatest reduction in developmental vulnerability, and particularly on the language and cognitive domain. So we were able to evaluate policies as well as specific interventions. So in terms of the fact that the data is publicly available, it's not held by government, everybody gets to see it. Parents, communities, everybody. Not clearly at an individual level, but at individual neighbourhood levels. The data is aggregated on the basis of where the child lives, not where the child goes to preschool or pre-primary. And that is because we look at it as an outcome of how well the communities have raised their children up to school age. Yeah? So we're trying to engage everybody, not just the education system, but all health services and everybody else in their role in delivering, as such, children into the early childhood system. The fact that it's one instrument across the entire country means that there's a consistency of language, a consistency of stakeholders coming to the table to talk about the one instrument. It's actually been quite amazing how just the fact that it's one instrument across the whole country has made a big difference to just the language around child development. This is just data for Queensland, one of the states in Australia. And I just want to highlight the language and cognitive skills. Queensland was the only state that had very low preschool participation. Most states were around about 80% participation already prior to the national policy change of making sure that every child had a minimum of 15 hours access to preschool at the age of 4. Queensland was a little bit different. They had got rid of preschool in the 1970s, and so they only had about 30% of children participating in preschool in 2009. By 2012, they had 75% of their entire population coming to preschool, and we see the biggest shift on the language and cognitive development, a little bit on cognitive communication skills, and some of the other domains as well as. But we saw the biggest shift here, and we believe that we can align that directly to the policy change. Data is also, as I said, available at a community level, so every single community across the country can see how their data has changed over time. This is a community that was part of our piloting of the instrument. I first brought the instrument to Australia back in 2002, so it took 9 years from 2002 to 2009, which was the full census really in preparation and everything else, trying to get it to the entire country. So this was one of the first communities in 2003 that undertook the data collection, and we have data right now up to 2018. They have continued to see a reduction in developmental vulnerability. The federal government, on the basis of the data that they saw for this community, it's quite a poor community, put 3.8 million as an investment in 2004-05, and we've continued to see an annual improvement. So every community, not just national, everybody can engage around the data. So it's quite a strong advocacy tool. We're now linking the data into all of our population-linked data sets. So we're able to link the maternal information right through to later education records. We can show that this instrument predicts literacy and numeracy levels right up to year 9. We can go back and look at things like birth weight, et cetera, and show how that predicts the ADC results. So as the system grows as such, we're able to ask more questions and influence policy. Closing the gap is one of the big main issues that we have in Australia. Many of you will know that we have not treated our Aboriginal population very well for very many years, and we continue to not do so. Closing the gap is trying to bring the results of a whole lot of population indicators together so that our Aboriginal children are not, you can see how well they're doing and if they're increasing over time. ADC is one of the indicators for closing the gap, and thankfully we have seen an improvement for our Aboriginal children, but they're still a long way behind, and if we look at predictive models, it's looking like it's not going to be until 2060 or something ridiculous before we actually bring those gaps together unless we make some significant changes. So again, we use the data in a way to advocate it's publicly available. We try and do it in a safe way, but to also try and prompt our policymakers to get their act into gear. We have a whole lot of resources that are available at community level, services, et cetera. All of these are available on the ADC website, so you can download any of these if you'd like to have a look at them. So Tonga is my second example. So you may say, oh, well, that's okay in Australia. We don't have a lot of money, we can't do this sort of thing. In Tonga, we were able to capture every single 3 to 5-year-old across all of those 54 islands with transport costs and everything else with boats, et cetera, and we did it for 110,000. On the basis of that data, every single community now has mapped data. So let me just go to the maps first. This is the presentation of the data. This is one of the islands. As I said, there's 54 islands. This is the main island, Tongatapu, but there's 54. We have maps at every single island. Every single village within every single island is graded using a traffic light system. Green is good, red is bad. There is actually no traffic light in the whole of Tonga, but we still use this. So sometimes we were having to explain to communities that green is good and red is bad, orange is in between. But it means that the communities are able to compare themselves and start asking, why are our kids doing the way they are on each of these different aspects of development? And it just starts this real conversation. And we presented these maps to community forums. We went out, we showed them, and actually got a whole lot of people around the table. The Princess launched the results. It was all very exciting. Got a lot of press around it. We did it in, can't remember now, I think it was 2014, and again in 2017. We embedded a randomised controlled trial looking at community playgroups, and we were able to add economic analysis and been able to show at a community level those community playgroups we do a cost efficiency. For every $1 they save 8. So not only can you use the information for monitoring and advocacy, but you can also use it to embed impact evaluations and get outcome data relatively cheaply. That's also a very important point. So, that's not what I wanted to happen. What I did want to show was this slide to show you that the instrument is actually, why is this doing this? That's a bit different. So the Tongan instrument, when we went and talked to the community around what they thought a good, strong Tongan child when they come into early childhood education looked like, instead of the Western 5 domains, there are actually 9 domains. Right? So when we look at cultural identity, they were things like humility, loyalty, reciprocity, some of these other aspects that aren't actually captured in very many Western tools. This was important because it meant that those maps that we presented it for each one of these 9 domains, and it meant that we were able to have conversations with the Tongan people in the Tongan language with aspects of development that they cared about. Not a Western instrument coming in and saying, you know, this is what you should look like, right? It changes the dynamic of the conversation instantly to have an instrument that is developed locally. Now, having said that, out of the 90 items within this instrument, about 50 of them are pretty identical to any other Western instrument that you would see. But it went through the adaptation process, right? So there are still aspects that we can use to compare internationally. So these are just some pictures from the field work. As you see, it took boats and planes, and it was quite an exercise. Anyway, my takeaway messages, which aren't on this, because I only updated it recently. Takeaway messages were basically population monitoring. I know it seems like a big step to think about doing census data collection rather than a survey sample. I think it's worth considering because you're operationalising things, you're using your own staff, you're enhancing your own system, you're improving professional development at the same time, and it makes it easier to do it again and again and again over time, rather than these one-off type situations. It also means that you can embed evaluation, and that those evaluations are also always using the same outcome measure, so you can actually compare evaluations, right? Because you're using the same outcome measure. In not many circumstances can you do that in early childhood. It's one of our issues actually when we look at all of the impact evaluations around early childhood. It's very difficult to compare them and to determine how well that might work in different settings. In these countries at least, if you have one intervention in one community and another intervention in another community, if you're using the same outcome measure, you can actually, you've got far more power in being able to know what works and what doesn't work and on what aspect of development. Anyway, that's it from me. Thank you.